dependent on the availability of vaccines supplied to the country. Our vaccine cluster is working hard to secure more vaccine doses given the shortage in global supply. When more vaccines come, we can exponentially increase the pace of our vaccines. Nais ko rin po magpasalamat sa lahat ng ating mga healthcare workers, government workers na nagtatrabaho po araw at gabi upang mapabakunahan ang ating mga kababayan, umulan man o umaraw. Maraming salamat po. Ngayong araw po ay magbibigay tayo ng ilang updates sa ating COVID-19 situation at sa Delta variant cases. Next slide, please. Nationally, risk classification remains to be at low risk with an average daily attack rate continuing to decrease in the recent week. However, more regions are experiencing a trend reversal to positive 2-week growth rate. The National Capital Region now with 11 areas at positive 2-week growth rate. There is a need to identify the causes for this increase in cases in these local governments to preserve the gains achieved in the past 2 months. The detection of the variants of concern can be correlated with the case spikes that we are experiencing. We need to continually strengthen border control versus continuous travel bans, given that the list of these countries with variants of concern and case spikes grow longer every day. Next slide, please. For the national situationer as of July 22, 2021, we have a total of 530,266 reported COVID-19 cases, of which 50,562 or 3.3% are active cases. Over 1.4 million or 94.94% are recoveries, and more than 26,000 or 1.76% are deaths. Looking more closely at our active cases, 96.01% or 48,543 of these are asymptomatic, mild, or moderate cases, while 3.99% or 2,019 cases are severe and critical. The top 5 regions continuing or contributing to these new cases being reported are regions NCR, Region 4A, Region 7, 6, and Region 3. While the top 5 areas contributing to these new cases are Cavite, Laguna, Ilocos Norte, Bulacan, and Aklan. Now, given our epidemic curve, we saw a decline since our peak in cases in the first week of April. Since May, however, cases started to slowly rise up again. Looking at the contribution of each region to these cases, we can see that since the surge, the National Capital Region cases have continuously gone down. These are the dark blue bars, while Region 6, the violet bars, and the other regions, the black bars, shows consistent increase and are now taking up a larger part in the total number of cases in our country. National cases saw an increase in the recent week. Cases from July 16 to July 22 recorded 5,666 cases per day, and an increase of 626 cases per day compared to the previous week, which was at 5,040 cases. Next slide. National cases saw an increase in the recent week. Cases from July 16 to July 22 recorded 5,666 cases per day, an increase of 626 cases per day compared to the previous week's 5,040 cases. Looking at our cases by these island groups, after a slow decline in the past weeks, the case trend in the National Capital Region plus areas, which is the green line, is showing an increase in the recent week. Visayas is also showing an upward trend in the number of cases, while Mindanao, the orange line, have a slight increase this week, and case trend in the rest of Luzon, which is the red line, is plateauing. Next slide. In NCR, the 7-day moving average shows signs of increasing trend as cases in the recent 7 days have exceeded the previous 7 days by 179 cases. Our average daily reported cases from July 16 to 22 is at 797. Next slide. All provinces here in this slide shows an increase in cases on our plus areas, with Cavite, and Bulacan with the fastest increase. Next slide. Now, if you will look at this slide, cases increase are seen in Cavite and Bulacan, while cases in Laguna and Rizal are plateauing. So this slide would show us the rest of Luzon, where there is an upward trend that is observed in regions 2, region 3, and region 4A, while there is a downward trend seen in region 5. Region 1, region 4B, and CAR are showing plateauing trend in cases. Next slide. In Luzon, regions 1, 2, 3, 4A showed an increase in cases, while regions 4B, 5, and CAR are showing downward trends in our cases. Next slide. There is a steep rise in cases observed in region 7, while there is a decline in region 8, and cases trend in region 6 is plateauing. Moving on to this slide, next slide please, we can observe that there is this sharp increase. This is Mindanao already. So region 10 showing fast increase in cases, Caraga and Barm also showing increase in cases, while region 9 and region 11 exhibiting continuous trend, downward trend in cases, while case trend in region 12 is plateauing. So for our biosurveillance updates, next slide please, we have the 7,579 or 85% are with lineages that we have detected. The latest run comprised of 373 samples, that was July 21, and the variants of concern detected in the latest run were Alpha variant, 187 cases, Beta variants at 142 cases, and Delta variant at 12 cases. Incoming travelers comprise 651 or 7.3% among these samples tested. Next slide. Of the 7,579 sample sequence assigned with a lineage as of July 21, 24.1% of samples were positive for the Beta variant, 22% of samples were positive for the Alpha variant, 0.6% or 47 samples are positive for the Delta variant, and 0.03% or 2 samples are positive for the Gamma variant. Next slide. Among the 35 Delta variant cases in our country, 24 have recovered, 3 individuals died, and 8 remain to be active after validation and repeat RT-PCR conducted by our epidemiology and surveillance units. 24 are returning overseas Filipino workers, while 22 had been identified to be local cases. 66% or 23 are males, and cases belong to the age group 14 to 79 years old. As for the vaccination status, 2 cases received 2 doses of COVID-19 vaccine, 4 cases received 1 dose, while 18 cases were confirmed to be not vaccinated, and the vaccination status of the 11 cases is currently being verified. Among the 12 Delta variant cases in this run, there were 6 from region 3, 2 from region 4. There were 6 from region 3, 2 from region 4A, and 4 from the National Capital Region. So you would see in this slide the different areas where we have identified these Delta variant cases. There were 6 in Bataan, 2 in Laguna, 1 in Manila, 2 in Pasig City, and 1 in Taguig City. Lindsay?
Thank you for Yusek. Ma'am, I will now be going through the questions po as sent in our Viber group and mailing list. So you said we have several questions po regarding the number of Delta variant cases na vaccinated na po. Do we have data on this po, ma'am?
Again, Lindsay, I'm sorry.
How many Delta variant cases na daw po ang vaccinated?
As what we have said a while ago, we were able to confirm Yun lang pong meron tayong datos sa ngayon. No? So pinakita natin, 2 po yung fully vaccinated, 4 received 1 dose only of a specific type of vaccine, and 18 po ay hindi bakunado, and for the rest, we are still getting the status of their vaccination.
Thank you po, Yusek. Yusek, kamusta daw po ang contact tracing ng ating Delta variant cases? Lalo na po na 12 local cases pong muli ang na-detect sa pinakahuling batch ng genomic sequence.
Sa ngayon naman po, no, katulad ng naibalita natin sa inyo noong Lunes, tayo po ay maigting na nagko-contact trace ang ating mga local government units. We still have to receive the complete reports of these contact tracing efforts, but local governments are doing their contact tracing right now.
Thank you po, Yusek. Yusek, to clarify, kasama daw po ba sa latest sequencing run yung 5 samples taken from the crew of the barge docked off the shores of Albay? Ano po ang results ng sequencing nila?
Hindi pa po kasama dito po sa latest sequencing run natin itong 5 individuals from Albay na nandun sa vessel. Ito po isasama dito sa next run natin.
Thank you, ma'am. Only the PGC has the capability to do whole genome sequencing. Is there any way where the private sector can help in speeding up the sequencing?
Of course, no? So kahapon po napag-usapan na with the experts kung paano po tayo makakahingi pa ng tulong sa iba't ibang sektor ng ating lipunan regarding the whole genome sequencing. Actually, when it comes to machines, kompleto po ang Philippine Genome Center. Meron po tayong 5 malalaking makina sa Philippine Genome Center. As to reagents and the kits, tayo po ay nakapagtulong na sa Philippine Genome Center kung saan tayo ay nag-provide ng funds para makabili po tayo ng reagents and kits good until the end of the year. As to the healthcare workers po, natulungan na po ang Philippine Genome Center ng University of the Philippines kung saan binigyan po sila ng extra funds to hire additional staff para po dumami yung ating mga cadre dito sa Philippine Genome Center at mas bumilis ang ating trabaho. As to the machines naman po for extraction, katulad ng sabi natin, ito po yung nakapagbigay tayo ng pondo sa Philippine Genome Center. But of course, the procurement will take time kasi may proseso pa rin po. Kaya ito po siguro ang hihingi natin ng tulong sa ating mga private sector counterparts. These extraction machines, kung meron maipapahiram o di kaya ay maidodonate sa Philippine Genome Center, para po bumilis-bilis po ang ating proseso, makapagdoble po tayo ng outputs for whole genome sequencing.
Thank you po, Yusek. From Claudette Siriaco, hospitalization rate in other countries like the UK indicated that Delta variant causes a more severe course of illness rather than a milder one. How prepared is our healthcare system now?
Claudette, itong nakita mong datos, no, may nakikita rin kasi tayong datos na bagamat tumataas sa mga kaso sa UK, nakikita natin na mas bumababa naman ang hospitalization because most of them are vaccinated already. Pinag-aaralan pa rin po ngayon ng mga eksperto across the globe kung merong talagang factor ang Delta variant sa paghaba ng pagkaka-ospital o mas severe na infection ng isang individual with a Delta variant. As to how we are preparing for this, katulad ng sinasabi namin, kami po ay we are hammering down on our hospitals and local government units para po tayo ay makapagdagdag ng extra ICU beds. Tayo po ay nag-pre-position na ng mga logistical supplies and equipments katulad po ng mechanical ventilators, high-flow nasal cannula. Yun pong ating mga oxygen, katulad ng aming binanggit, ay nakapag-inventaryo na tayo and we are coordinating now with the manufacturers. So ngayon po, pag tinignan natin ang healthcare workers natin, especially our specialists across the Philippines, makikita ho natin yung kapasidad natin na gumamot ng mga severe COVID-19 infections at ang ating mga doktor po ay naging bihasana sa paggagamot ng mga ganitong infections. So hopefully, we can be able to manage. Kailangan lang po talaga ng tulong ng komunidad para hindi naman ganun kadami ang mapunta sa ospital kung sakasakali.
Thank you, Yusek. From Job Manahan, hingi lang po ng comment sana regarding a polling research and consulting firm statement sa NCR na NCR is seeing a surge in its early stages that may be driven down ng Delta variant. Does the DOH also agree that the region should revert to a stricter lockdown level?
When we try to revert, this will be because it is anticipatory. Wala pa ho tayong nakikita ngayon that objective basis that we will be announcing that there is already this surge. Let us try to go back to the definition of a surge. So kailangan lang po natin maging maingat sa pagbibigay ng impormasyon sa ating mga kababayan dahil sa ngayon po takot na yung ating mga kababayan, huwag na ho nating dagdagan. Ibigay ho natin sa kanila yung totoong impormasyon. At ang totoong impormasyon, maari tayong dumating dyan sa pagtaas ng mga kaso, pero sa ngayon, hindi pa ho natin nakikita yan. Kaya nga po tayo patuloy na naghahanda para po ma-prevent pa natin kung sakali na hindi naman tumaas ng husto ang mga kaso sa ating bansa.
Thank you, Yusek, for the next question. This was already answered through Yusek's presentation regarding yung location po ng 12 new Delta variant cases. So Yusek from Greg, with the detection of local transmission, do we consider the conduct of testing sa community or communities nila, at least with using antigen test?
Kailangan lang tayong very much guided, Greg, no, kapag ginagawa natin ito. Katulad po ng mga paunang rekomendasyon ng ating eksperto, kapag ka po tayo ay nagsususpetsya na Delta variant yung mga kaso, o kaya kahit anong variant of concern, let us use RT-PCR kasi hindi po natin pwedeng gamitin ang antigen test sa whole genome sequencing. Now, when we do our house-to-house case finding, kung saan mas pinag-iigting natin ang pag-detect ng mga taong na-expose o di kaya ay may simptomas na maaari naman pong gamitin pa rin ang antigen test, especially for those areas na mataas po yung mga pinapakitang kaso ngayon. But again, let me just emphasize, kapag talagang highly suspicious po tayo of these variants of concern, it would be more better kung RT-PCR ang gagamitin para ma-subject natin sa whole genome sequencing.
Thank you po, Yusek. From Claudette Siriaco, she's seeking clarification po. Sa press release po kasi nakalagay 2 Delta variant cases sa Calabarzon, pero according to Dr. Voltaire Guadalupe, may 5 Delta variant cases, 2 from Cavite, 2 from Laguna, and 1 from Batangas. 3 cases are OFWs and 2 cases with no foreign travel.
Yes, gusto ho nating klaruhin yan. Ang nire-report po ng Region 4A, si Dr. Voltaire, ang kanya po nire-report ay cumulative number of their cases of Delta variants na identified dun sa kanilang lugar. But for the most recent na in-issue po natin na additional cases, 2 lang po ang atin pong na-identify sa kanila. So yung pong 3 binabanggit niya were from the previous runs na nabanggit po niya ay mga returning overseas Filipinos at ito po ay nai-report na po natin in the previous days. So sa ngayon po, ito pong recent samples, 2 lang po ang na-detect natin dito sa Laguna.
Thank you, Yusek. From Sheila Crisostomo, ano daw po ang panawagan ng DOH sa paglusong sa baha? May we request po for data on leptospirosis?
Yes, no? So Sheila, sa ngayon, no, salamat sa pagbibigay mo ng ganyang question because we'd like to remind lahat po ng ating mga kababayan na nandito na naman po ang tag-ulan, nandito na po ang mga pagbaha. Kailangan po tayo maging mas maingat, lalong-lalo na kung tayo ay lumulusong sa baha. Alam po natin ang sakit na leptospirosis ay maaari natin makuha kung tayo po ay may mga galos, may mga cuts sa skin o may sugat sa paa. At kapag tayo ay lumusong, maaari po tayong ma-infect nitong leptospirosis. Sa ngayon po, there is a cumulative total of 589 leptospirosis cases that were reported from January 1 to June 19, 2021. This is 13% higher compared to the 520 reported leptospirosis cases of the same time period in 2020. Ang case fatality rate po ng 2021 of this same time period is 11.4%, which is 1.6 higher than in 2020 at 9.8%. The highest leptospirosis incidence rate was noted in the CAR region with 1.49, followed by Region 6 at 1.34 and Region 2 at 1.33 per 100,000 population. So kami po uli ay nananawagan sa ating mga kababayan, tayo po ay mag-iingat kapag tayo ay lumulusong sa baha. Kailangan po natin magsuot ng mga protective gear. Kung talagang hindi maiiwasang lumusog, magbota po tayo. Tayo po ay laging maglilinis ng paa pagkatapos tayo ay lumusong, ugasan ng sabon at saka ng tubig. And kailangan po, linisin po natin yung kapaligiran natin. Nakukuha po natin ng leptospirosis dahil po sa mga ihi ng mga hayop at na napupunta po dito sa mga gutter natin at tubig. So itapon maigi ang mga basura, linisin ang environment, tanggalin po natin yung mga nakabara dun sa mga gutter natin para hindi rin po nag-iipon ang tubig dyan sa ating lugar. Aside from leptospirosis, when there is this because of the rainy season, no, maaari din po tayo makakuha ng dengue kung meron pong mga tubig na nanatili na stagnant dyan po sa ating mga lugar.
Thank you po, Yusek. From Greg Gregorio, may we get DOH reaction on the recent Facebook post of PGH spokesperson Dr. Jonas saying that the number of COVID-19 infection among vaccinated healthcare workers in PGH has decreased based on their May to June 2020 and May to June 2021 data?
Yes, we agree with that. No? So we're getting this kind of reports also from our other hospitals kung saan bumaba na po ang mga kaso na nagkakasakit na healthcare workers ngayon dahil most of them are fully vaccinated already. So dito pa lang po sa mga ganitong anecdotal reports and evidences, we can say that vaccines really work. So magpabakuna na po tayo lahat para tayo lahat ay protektado.
Thank you po, Yusek. From JC Cosico, are we seeing a downward trend in the number of cases or hospitalization and deaths nang simulan po ng government ang COVID-19 vaccination program? Do you have data po on this?
Meron po tayong mga pagbaba ng mga kaso ng pagkakamatay, no? All over the Philippines and even in the different regions, no, specific. Pero hindi pa rin ho natin ma-attribute ito sa pagbabakuna lang, no? There are a lot of factors that can contribute to this. So pinag-aaralan po natin mabuti yan at tayo po ay magbibigay ng impormasyon kapag nabuo na po natin yung mga ginagawa nating mga mini-study para dito sa bakuna.
Thank you, Yusek. Yusek, I will now be reading the questions po sent through Viber. From Caroline Bongkin po, hindi daw po na-inform yung Kalamba na merong Delta variant sa kanila. Sa Manila naman po, sabi 3 weeks bago na-inform na may Delta variant. Yusek, can we explain lang po yung process from yung testing to genomic surveillance po hanggang makarating po yung results sa mga local government units? If we can clarify that po.
Yes, no? So unang-una, Caroline, no, ang ating proseso, kapag po ang ating local governments are already guided on how they will be selecting samples to be sent to the Philippine Genome Center. So halimbawa po sa isang lugar, nakakita sila ng pagtaas ng kaso or clustering of cases or sa ospital nila, nakakita sila ng kakaibang presentasyon ng mga sintomas. Ito po ay pinipili nila para maisama sa sampling na binibigay sa Philippine Genome Center. So that's the first step. Doon pa lang, alam na ng local government na nagpadala sila ng ganitong sample sa ating Philippine Genome Center. Pangalawa, kapag dating sa Philippine Genome Center at naproseso na at inilabas na ang resulta, ang unang-unang ginagawa po ng aming team dito sa DOH ay tawagan itong mga local governments kasi kailangan po namin ng additional details para po makompleto namin yung mga detalye nitong mga nag-positive sa variants of concern. So there is already coordination at that point in time. Now, we coordinate with our epidemiology and surveillance units, and we recognize also the call of our city officials or public officials, local officials na nai-inform po sila. And we do that through our epidemiology and surveillance units. So nakapagsasabi tayo. Na ngayon, ang punto naman po natin kung bakit po tayo ay nag-aanunsyo at may specific po tayo na areas after we have informed the local governments is for us to inform the public as well. Hindi po para takutin, kung hindi para po sila ay magkaroon ng awareness at para po sila ay mas mag-ingat because the variants of concern are being detected in their localities.
Thank you po, ma'am. Ma'am, from Caroline po ulit, are we still able to contain the local transmission of Delta variant before it progresses to community transmission?
Well, that is the objective, Caroline, no? Kaya tayo ay nag-iigting ng ating mga ginagawang measures ngayon at talagang tayo ay nakikipag-usap sa mga local governments dahil ayaw naman natin na patuloy na kumalat ang mga variants of concern, specifically the Delta variant. So tayo po ngayon ay trying to implement all of these strategies, this four-door policy kung saan from the borders hanggang sa komunidad ay atin pong binabantayan maigi para ma-control man lang natin ito or mitigate natin yung mga epekto na ibibigay sa atin itong Delta variant na to. So hopefully we can be able to manage and control the spread and not into community transmission.
Thank you po, Yusek. Yusek, from Patricia Denise Chu, for the 12 data cases recently identified, will any of them be retested to verify if recovered na po talaga or if baka may active cases ulit like the last time? Have these cases been asked to isolate again?
Tama yan, Patricia, no? That's our protocol actually. When we detect this variant, ang ginagawa po natin, binabalikan po natin yung mga individuals that were identified to have this Delta variant at atin po silang pinire-retest and then we quarantine them until we can get the results. Kapag ka po sila in the previous na yung sa RT-PCR positive ay nakakompleto na ng 14 days ng kanilang isolation, pagkatapos nung ni-retest natin sila, negative sila, maaari po namin silang ibalik sa kanilang bahay pero with close monitoring ng local government. But if they turn positive kahit na asymptomatic sila, katulad nung 8 nating previous cases, na naka-quarantine pa rin po sila hanggang sa ngayon, hanggang makatapos po tayo ng 14 na araw.
Thank you po, Yusek. From Caroline po, Yusek, ano po ang severity ng COVID-19 infection ng Delta patient na fully vaccinated versus one dose pa lang and yung mga hindi pa nababakunahan?
Hindi natin yan may kumpara ngayon, Caroline, but if you would look at evidences across the globe, you will see that most of those vaccinated, if they get infected, are only getting mild infections. And we are also seeing that here in the Philippines, kung saan yung mga fully vaccinated, magkaroon man ng sakit, sila po ay having mild cases lang and easily recovers.
Thank you po, Yusek. Yusek, for clarification lang daw po, ano po ang difference ng local versus community transmission? And do we have the capacity to detect community transmission?
When you talk about local transmission, you can see the linkage of one individual tested for a COVID-19 virus or variant at malilink mo yan sa another individual. So you are seeing the relationship of these different cases among each other. Pero pag sinawag mo na siya na community transmission, you do not see this linkage anymore. Ibig sabihin, gano'n na kadami ang kaso nung SARS-CoV-2 virus or COVID-19 or marami ng variants at hindi mo na nakikita kung saan nagmumula at hindi mo na nakikita ang relasyon ng isang kaso dun sa another case. So that is already community transmission. As for us to have that capacity, well, we will have that capacity based on our analysis that we do, the phylogenetic analysis, we do whole genome sequencing, at nakikita naman tayo, no? Nakikita naman natin. Kaya nga, ang lagi namin ine-emphasize, we do this rational and purposive sampling para yung objectives po nung ating pag-sequence ay mas maging efficient for us. Nakikita natin yung extent ng mga detection natin ng variants dito. Nakikita natin nasaan sila. Nakikita natin kung meron pa silang relationship between and among each other. So sa ngayon, na-establish natin there is local transmission because we were able to establish the linkage of these cases, some of these cases with the other cases of Delta variant.
Thank you po, Yusek. From Sheila Crisostomo, with the local transmission of Delta variant, is there a need to disallow again senior citizens or at least those 65 years old and above from going out? Napapag-usapan na po ba ito?
Well, lahat pinag-aaralan ngayon, kasi nakikita natin na gusto natin maging prepared talaga tayo. But we need to be objective kasi naririnig ko, gusto ko lang klaruhin, naririnig natin lahat yung clamor ng mga local governments na i-lockdown nyo na kami, gawin nyo na kaming mas mataas na community quarantine classification kasi may Delta variant. Pero kailangan objective po tayo sa ating mga pag-i-implement nitong mga stricter measures, lalong-lalo na yung lockdown or whole lockdown of a province or a city. Dahil nakikita rin po natin yung epekto nito sa ating ekonomiya. We need to balance this with health. That's why we need to be objective. Tignan po natin na yung mga kaso po sa mga piling lugar na sinasabi natin may Delta variant, kapag nakita namin na yung kanilang healthcare system ay kailangan ng tulong, nakikita natin patuloy ang pagtaas ng kaso, nag-i-implement po tayo na mas strict na community quarantine classification. Pero pag nakita natin that manageable at nakikita natin maigting namang pinapatupad ng local government ang kanilang PDITR, and we can see that their hospitals and their health system ay hindi pa ganong nasa threshold para magkaroon ng additional na classification for community quarantine, hindi muna po natin isasara. We will do granular lockdowns for that. So yun po yung ating ginagawa ngayon, balancing act po tayo, kailangan objective tayo lahat, huwag po tayong magpanic, kailangan lang tayo magtulong-tulong para po ma-prevent pa ho natin ang further spread nitong Delta variant na ito.
Thank you po, Yusek, for the last question. Paano daw po naging connected yung mga Delta cases to one another po?
Meron po tayong tinatawag na phylogenetic analysis. Ang phylogenetic analysis, ginagawa po ito ng mga skilled technical people natin sa Philippine Genome Center. And sila po ay pinag-aaralan lahat po nitong mga variants na na-identify through sequencing. So for this Delta variant, pinag-aralan po nila yung mga lineages at saka kung ano po yung mga characteristic ng bawat individual based from the sequencing that has been done. And they were able to connect, ito po, through this phylogenetic analysis. At nakita natin na meron po tayong mga onward transmissions coming from returning overseas Filipinos. Pag sinabi nating onward transmission, ibig sabihin, hindi nag-stay yung infection sa sarili lang niya, nakapanghawa siya. So that's onward transmission. Meron din tayong nakita na yung cluster of infections ng pamilya ay nanggaling sa isang tao na pumunta sa kanila, nakasama nila. So ito po yung mga nakita natin and we were able to establish linkages. For example, ito pong ating cluster of infection na isa dito sa mga may Delta variant, nakitaan natin na meron pong isang kapamilya nila na nagtatrabaho sa isang lugar at umuwi sa kanilang pwesto at doon po ay sila po ay nagkaroon ng pagkakahawa-hawa. So that is a link. Nagkaroon din po tayo ng isang returning overseas Filipino na umuwi dito dahil namatay ang kanyang nanay. And pagkatapos po noon, yung nanay niya, best friend po yung asawa nung nagkaroon naman ng sakit doon sa isang lugar dito sa ating bansa. At nung umattend ng wake po yung asawa nung nagkasakit, doon po nag-umpisa uli ang cluster of infection dito sa lugar na to. So we are seeing through phylogenetic analysis the narrative kung bakit nagkakahawa-hawa ang mga tao at nakita po natin dyan at na-establish natin na meron na tayong identified na linkage between and among these cases that we have for Delta variant. Kaya po tayo ay nakapag-anunsyo na that there is local transmission.
Thank you very much po, Yusek. Yusek, last na po talaga. I think the team is verifying this also. If we can verify daw po, kasi PMA said during a hearing na may Lambda na daw po na detect in the country sa Mindanao. Can the DOH confirm this po?
Wala pa po, no? So kung ano man po ang ating na i-announce at nasi-sequence, ang first-hand information po ay DOH, kami po. So sa ngayon, until now, with all of these sequences that we have done, we have not detected the Lambda variant yet. Ang Philippine Genome Center lang po nakakapag-test ng whole genome sequencing dito sa ating bansa. So ang information should be, at pagkakatiwalaan dapat ang impormasyon na galing sa Philippine Genome Center at saka sa DOH dahil kami po ang may hawak ng mga datos na ito. Wala pa ho tayong Lambda variant na nadidetect dito sa ating bansa.
Thank you po, Yusek. Yusek, last na po talaga, baka daw po pwede natin i-clarify kung saan daw po natin nakita yung mga local transmission po.
Well, we are seeing na linkage na dito sa mga Delta variants na na-identify natin. Nakita na po natin yung cluster of infection sa Northern Mindanao na nakita ho natin na ito ay family cluster, yung sinasabi natin kanina. Nakita rin po natin na meron din cluster of infection dito po sa Antique. So nakikita na ho natin isa-isa itong linkage ng mga kasong ito at patuloy nating pag-aaralan lahat ito para makita ho natin yung linkage at relasyon ng isang kaso sa isang kaso so that we can be able to further improve yung mga strategies na pinapatupad natin so that there won't be breaches at ma-manage pa ho natin at makontrol ang further spread of this infection.
Thank you very much po, Yusek. Before we end our media forum, meron po ba tayong final message to our media partners and of course to our viewers?
Yes, no? So, unang-una, gusto uli natin magpasalamat sa ating mga media partners. Alam po namin na katulong namin kayo sa paghatid sa ating publiko ng tama na impormasyon dahil napaka-importante po ng wastong impormasyon ngayon, mga panahong ito, dahil alam po natin na marami sa ating mga kababayan ang natatakot, nagpapanik dahil sa Delta variant. Gusto ko lang hong ipahatid sa ating mga kababayan, hindi kailangan magpanik. Kailangan lang po focus tayo. Kailangan always aware tayo. Kailangan tumutupad po tayo dun sa mga sinasabi nating safety protocols. Lagi po tayo mag-mask. Huwag po natin ilalagay ang ating mask sa baba. Wala po yan maibibigay na protection sa atin. Lagi po tayo mag-face shield. Kahit nasa loob tayo ng simbahan, isuot po natin ang face shield na yan. Napaka-importante, bibigyan kayo ng protection na yan. Huwag po tayong pupunta sa matataong lugar. Kung nakikita ng mataong lugar, huwag na muna po natin ituloy ang ating lakad. At lagi nyo pong sisiguraduhin na kapag kayo ay pumunta sa isang lugar, it is well ventilated. Alalahanin po natin ang Delta variant ay mabilis na makapanghawa. In a fleet of a second, maari po kayong mahawa, kaya dapat doble ingat po tayo lahat. Lagi rin naalalahanin, mag-uugas lagi ng kamay. Kung wala pong pang-ugas na sabon at saka tubig, gumamit po tayo ng alcohol. And most importantly, aside from the minimum public health standards, kailangan po natin magpabakuna. Kapag turn na po natin, eligible na po tayo, magpabakuna na po tayo dahil iyan ang magbibigay ng proteksyon sa inyo dito po sa Delta variant na ito. Gusto naman po natin magpaalala sa ating mga local government units, kasanggan niyo po kami sa pagpigil ng pagkalat ng impeksyon na ito dito sa ating bansa. Ngunit kailangan po natin pag-igtingin ang ating mga ginagawang measures na ngayon. Lalong-lalo na po ang contact tracing, ang testing, shorten the time na kayo ay nakakita ng isang individual na mayroong simptomas o di kaya ay exposed, dun po sa pag-isolate sa kanila. Kahit hindi niya pa ho sila natitest, maaari niyo na po silang i-quarantine within 24 hours so that we can cut the transmission in our localities. Makinig lamang po sa tamang informasyon, lalong-lalo na sa ating mga kababayan. DOH po, marami tayong platforms kung saan makakakuha po kayo ng correct at saka klaro na impormasyon para po tayo po lahat ay informed and we know what to do in these times of this Delta variant that is here in the country. Tayo rin po ay gusto ko lang ipaalala din sa lahat na yun pong vaccination natin ay tuloy-tuloy pa rin po. Marami na pong supplies na dumarating. Sana po ang ating mga lolo at lola, yun pong ating mga kababayan na may comorbidities, magpabakuna na ho tayo. Let us get ourselves protected para po hindi tayo nagkakaroon ng agam-agam when it comes to this Delta variant. So yun lamang po. Maraming salamat and happy weekend to all of you. Thank you, Lindsay.
Thank you very much po. Happy weekend.